Most people think of blood pressure management as a long-term project, medications that take weeks to optimize, lifestyle changes that accumulate over months, results measured across a year of follow-up appointments. That framing is accurate for sustained change, but it misses something important that the research on dietary nitrates has been demonstrating clearly. Certain foods can produce measurable cardiovascular effects within hours of eating them. And one of the most powerful examples of this is spinach. 2 peer-reviewed studies give a specific and detailed picture of what spinach actually does to blood pressure and how quickly it does it. The mechanism is clear, the data is specific, and the implications for anyone managing blood pressure through diet are genuinely useful. Start with the mechanism, because understanding it makes the research findings make sense, rather than seeming arbitrary. Spinach is one of the most concentrated dietary sources of nitrate available in a common food. Dietary nitrate, written as NO3, is a naturally occurring compound found in high concentrations in leafy green vegetables, particularly spinach, arugula, Swiss chard, and rocket. When you eat nitrate-rich foods, the bacteria in your saliva begin converting nitrate to nitrite. From there, nitrite is absorbed into the bloodstream and, particularly in conditions of low oxygen or high acidity such as in working muscles, is converted further to nitric oxide. Nitric oxide is a signaling molecule that tells the smooth muscle cells in blood vessel walls to relax. When those muscle cells relax, the vessel walls dilate and widen. Wider vessels mean less resistance to blood flow, which means the heart does not need to pump as hard to move blood through the body. Blood pressure drops. This is vasodilation, and dietary nitrate from spinach triggers it through this specific biochemical pathway in a way that is both rapid and measurable. The first study provides concrete numbers on exactly how large this effect is. Participants consumed approximately 400 milligrams of dietary nitrate from nitrate-rich vegetables, including spinach and arugula, which is roughly equivalent to about 4 cups of raw spinach. The blood measurements that followed were striking. Plasma nitrate levels in participants increased 6-fold. Plasma nitrite levels, the intermediate step toward nitric oxide production, increased 4-fold. And systolic blood pressure dropped by approximately 5 millimeters of mercury within hours of consumption. The researchers noted that these effects were comparable to those seen with beetroot juice, which is the dietary nitrate source most extensively studied in cardiovascular research, and the one typically held up as the benchmark for this category of intervention. The second study took a more controlled and longer-term approach. Participants consumed 250 grams of high-nitrate spinach soup, which contained approximately 845 milligrams of dietary nitrate, compared to a control group that consumed 250 grams of low-nitrate asparagus soup, containing less than 1 milligram of nitrate. This comparison was maintained over a 7-day intervention period. The spinach group showed 2 distinct and significant findings. Central systolic blood pressure was reduced by 3.4 millimeters of mercury, and arterial stiffness was reduced by approximately 7%. The arterial stiffness finding deserves specific attention because it is often more clinically significant than the blood pressure number alone. Arterial stiffness is the reduced flexibility and compliance of artery walls that occurs as plaque accumulates, as collagen replaces elastin in vessel walls with age, and as chronic inflammation damages endothelial tissue. It is an independent risk factor for cardiovascular disease, meaning it predicts heart attack and stroke risk, even after controlling for other factors, including blood pressure. A 7% reduction in arterial stiffness from a week of high-nitrate spinach consumption is a meaningful finding that goes beyond the blood pressure headline. The blood pressure reduction numbers in these studies, 5 millimeters of mercury in one and 3.4 in the other, require context to appreciate. A 5 millimeter reduction in systolic blood pressure may sound like a small change on a scale that typically runs from around 100 to 180. But epidemiological research has consistently shown that sustained reductions in blood pressure of this magnitude, maintained over years, are associated with meaningfully lower rates of heart attack and stroke at the population level. The cardiovascular benefit of a 5 mm systolic reduction is comparable to the benefit of several widely used antihypertensive medications, particularly when that reduction is maintained through dietary patterns rather than achieved and then abandoned. The practical question is how much spinach is needed to produce these effects reliably. The research points to roughly 4 cups of raw spinach, or about 200 to 250 grams of cooked spinach, as the quantity associated with the measured outcomes. This is a substantial but not impractical amount. Raw spinach collapses dramatically in volume when cooked, meaning 2 cups of raw spinach sautéed produces approximately half a cup of cooked volume. Building a 200-gram spinach intake into a daily pattern through smoothies, salads, sautéed side dishes, and additions to pasta or eggs is achievable without spinach becoming the dominant feature of every meal. Arugula and Swiss chard are similarly high nitrate greens that produce the same mechanism through the same pathway. Beets and beetroot juice are the most studied nitrate sources overall. Rotating across these options maintains variety while consistently delivering the nitrate load associated with the cardiovascular effects described in this research. It is worth being precise about what this research does and does not establish. Spinach is not a replacement for antihypertensive medication in people with established hypertension. A person whose blood pressure is 160/100 needs medical management. What spinach adds to that picture is a dietary complement that, used consistently, contributes meaningfully to the overall blood pressure management strategy. For people with borderline or mildly elevated blood pressure who are trying to manage it through lifestyle changes before reaching for medication, the evidence for high nitrate leafy greens as a dietary tool is strong and specific. For people with normal blood pressure who want to maintain it and protect their arterial health over the long term, spinach and other high nitrate greens are among the most evidence-supported dietary choices available for that purpose. Blood pressure is one of the most modifiable cardiovascular risk factors available to most people. Diet is one of the most accessible levers for managing it. Spinach is one of the most evidence-backed dietary tools within that lever. That chain of reasoning is worth acting on. There is an additional dimension to the spinach blood pressure story that is worth understanding: the role of oral bacteria in the nitrate to nitric oxide conversion. The first step in converting dietary nitrate to nitric oxide happens in the mouth, where bacteria on the tongue and in the saliva convert nitrate to nitrite. This is not a passive process. It requires a healthy oral microbiome with sufficient populations of the relevant bacteria. Antibacterial mouthwash, used before eating nitrate-rich foods, has been shown in research to significantly blunt the blood pressure-lowering effect of beetroot juice by killing the oral bacteria needed for the initial conversion. This suggests that using antibacterial mouthwash habitually, while beneficial for gum health in other ways, may reduce the cardiovascular benefit of dietary nitrate. The timing matters. Rinsing with antibacterial mouthwash immediately before eating spinach or other high nitrate foods removes a key step in the mechanism. This is a small but practically relevant consideration. It does not mean abandoning mouthwash. It means being thoughtful about timing and recognizing that the benefit of dietary nitrate depends on the full biological system working as intended, from the bacteria in your mouth to the enzyme systems in your blood vessel walls that ultimately produce the vasodilatory effect. The evidence on spinach and blood pressure is specific, mechanistically grounded, and clinically relevant. It belongs in the toolkit of anyone managing cardiovascular health through diet, which includes far more people than those who think of themselves as actively doing so. New videos every day covering the nutrition science that gives you specific, actionable information about your health. Subscribe and stay